Well, we were set up in 1989, some 30 years ago, mostly to help coordinate this new science of health technology assessment. Now, one of the key aspects for why HTA is important is after a regulator looks at a product, whether it's a medical device or a drug, there's still a lot of uncertainty, particularly with respect to the value that that particular drug or technology provides to patients and to the healthcare system. The regulator looks at that product very specifically from a quality, safety, and efficacy using a risk-benefit framework. But it doesn't look at its comparison with current therapies or with its cost effectiveness, that value that it brings. So that's the specific role that we play, is we look at the comparative clinical effectiveness. We also look at the cost effectiveness for both drugs, medical devices, procedures, diagnostics, clinical interventions, etc. So at CADTH, we have a number of different programs. If I refer to our drug programs, we have 2 standing expert committees that do these comparative assessments. We receive input from clinician experts as well as patients. We put all of this together and come up with a recommendation. Now, the payers, the public payers in Canada, will not provide payment for any new drug until they receive a recommendation from us. So they are really relying on us to provide them with that expertise on the value that that drug or technology provides to the system. And we do a similar type of work in our drug space. Now, where we've also placed a significant new effort recently is on managing these health technologies. So we're kind of shifting our thought from being about health technology assessment to being about health technology management. So that requires us to look at implementation factors and considerations, ensuring we're getting good input from patients, and looking at all of the qualitative factors, legal issues, social issues, contextual issues related to that. And it's all put together in a package that we provide that good evidence to the people that need to make the decisions about whether to pay for and list a new drug or a new technology.
Now we have cuts. And now the role of NICE has become a bit harder because it needs to identify things we should stop doing as opposed to saying yes to new things. NICE hasn't been very good at identifying things we should disinvest from, but it has been relatively good at negotiating prices, and this is the latest thing which the government has allowed NICE, together with NHS England, which is the budget holder for the National Health Service, to work together with industry. NICE and HTA are important elements of health systems which strive to achieve, attain and sustain universal healthcare coverage. Health technology assessment is a systematic process which allows you to consider the evidence as to whether something is better than something else you already have and how much extra we're willing to pay for it. But it also allows you procedurally to engage different stakeholders, to engage industry. The rules of the game are clearly set out and everybody can engage. And even if people don't like the decision, there's a lot of evidence and a lot of due process to support and defend those tough decisions. Without such a mechanism, it's really difficult to see how a universal healthcare system could continue adopting new technologies without the budget growing too fast to manage, even in countries where there is money there to invest in healthcare services.
Why do we have mechanisms for economic evaluation? This is because we want to get the best value for money. We all know that resources are finite. No matter how rich you are, I know Taiwan is much richer than Thailand, but still you have limited resource. So that's why we establish HITECH to produce evidence from economic evaluation.